I'm Dr. Sengupta. I'm a chest specialist, and I have been asked to talk a little bit about the new disease which everybody is panicking about. First of all, its name is not coronavirus. The virus's name is SARS coronavirus 2. The disease is COVID-19. There are lots of viruses which cause lots of infections all the year round in people all around the world. On an average, 4 respiratory tract infections happens to everybody in the world. Now, some of them, as you can see, can kill people, and that is the reason this is a problem. How bad is this? This is on a scale of 1 to 10. This is 10 times worse than an ordinary flu, which you have all lived through all winters in the last every year of your life. How bad is it for people who are elderly? It is much worse than the young people. I'm all aware of that, and also people at risk. People at risk being people with uncontrolled diabetes, blood pressure, cardiac disease, kidney disease, and anything which suppresses your immunity. What should you do, or what should we do about it? Well, the doctor's parts are very clear and should not be discussed actually in public on what the medication support and everything is. It just does not help anybody. From the point of view of the public or as a lay person, you should follow the instructions of your local government and health authorities as and where applicable. You've all heard about isolation. It's a good idea to minimize contact with anybody which is not essential, particularly in groups of large numbers of people where most of these things can spread like wildfire. However, individually doing that and everybody doing that is different, and if everybody does that, as you've seen in China, it can control the outbreak very, very efficiently. As a matter of fact, you can also individually isolate people at risk, say the elderly people at home, your parents, your grandparents, your whoever is there, and that would also be thought of. It's a psychological isolation. Don't get within 3 to 6 feet of them. Wash your hands before touching anything. Wash your hands after touching anything. Make sure you don't touch your face and mouth. Don't need any masks. I need to take this message to everybody. People who are asymptomatic should not use masks. They are endangering the lives of doctors, nurses, healthcare workers, and anybody who is a patient. Only patients or people who have symptoms of disease should wear masks, and their carers, either doctors or people looking after them at home. If you buy a mask while being asymptomatic, A, you increase the risk of your own disease, and B, you're taking it away from people who need it. So a strong recommendation against using masks at all unless you're symptomatic. And is there a cure in sight? Well, of course there will be at some point of time, but I think we need to focus on what we can do right now, right here, and let's hope that all these measures will be sufficient.